It's not possible to get rid of a bunion without surgery. No, there are certain splints that you can use to keep the toe a little bit straighter, but that will not remove the bunion, which is essentially a bony prominence at the base of the big toe on the inside. So there have been more than 50 different surgical options for bunions over the years, which probably means that we've not yet perfected what is the ideal operation. But I have distilled things down such that I tend to use one of three different operations. The first is what's known as the scarf, with or without aching osteotomy being cutting and resetting of the bones. So that involves cutting and resetting the bone at the base of the toe and one of the bones within the toe itself, together with releasing the soft tissues on the side of the second toe that is tending, and those soft tissues are the ones that are tending to pull the big toe across to the second toe and get tight when you have a bunion. The second option is to fuse one of the bones joints in the middle of the foot and with that fusion, i.e. joining of the bones together, one can correct the position of the bone at the base of the big toe that is sticking out on the inner aspect and leading to the bunion. This is known as a lapidus procedure. And the final option is is the first MTP fusion, which is fusing the joint at the base of the big toe. That's done if there's a very significant deformity, and the higher the deformity, i.e. the angle of the big toe towards the second toe, the greater the chance of the angulation coming back after the two types of operation I've described earlier. Whereas if you fuse the big toe, that position will be maintained forever. It's not going to change. That has some slight drawbacks in that you lose the joint movement at the base of the big toe, but you can compensate for this to a degree by upwards movement of the joint in the toe of the big toe itself. Sometimes patients have a bunion, i.e. the bony prominence, and also some arthritis in the big toe. And this big toe fusion, the first MTP fusion, gets rid of this arthritis as well as allowing us to correct the angulation of the big toe. There is one other option that is occasionally used, which is minimally invasive bunion surgery, so-called keyhole surgery, which seemed to be very trendy a few years ago, but the vogue of this seemed to have decreased. It's not keyhole surgery like we talk about keyhole surgery from the knee, or the ankle indeed, or even the hip or the shoulder, because we're not using a telescope to look inside. We're just making small incisions in the skin and being guided by the X-ray. This is therefore quite complicated, and in my opinion, the advantages of this do not outweigh the disadvantages. And so, although it's possible, I've tended to veer away from this over the last few years. And those three major treatment surgical options tend to cover the whole raft of bunions that I see, both from the mild through to the severe. Unfortunately, it does take a little time. The bones tend to take about 6 weeks to join up. So after the scarf and aching osteotomies and after the big toe fusion, patients tend to be in a post-operative shoe, which has a rigid sole for 6 weeks. Tends to be a little bit longer with the lapidus procedure, the fusion of the bones in the middle of the foot. And sometimes patients have to be in a plaster for a little period of time immediately after that operation. Unfortunately, the swelling after bunion surgery tends to last around about 3 months. And as one of my mentors used to say, 3 months good, 6 months better, 12 months best. And that's probably a fair reflection. Normally, patients are able to start walking after 6 weeks without the post-operative shoe on, and therefore return to driving around about that time. But sporting activity tends to take around about 3 months to return to. So reducing swelling in the first couple of weeks after an operation, I advise people to keep their foot elevated higher than the level of their hip as much of the time as possible. So roughly, I say 45 minutes out of every hour. And then once you come out of the post-operative shoe, trying to get your foot into a relatively normal shoe will decrease the swelling to a degree. And then as you increase your activity, the fluid starts being pumped more effectively back to the heart, and therefore the swelling will also decrease. I tend not to suggest that patients wear compression socks. That it's always an option, but not one that I tend to use on a regular basis. So it is possible. There's no particular reason why people can't wear heels after bunion surgery, except if you perform a first MTP fusion. So that's the fusing of the joint, the bones at the base of the big toe. And after that operation, you can usually wear a slight heel. But because the scarf and aching osteotomies procedure or the Lapidus procedure does not restrict the movement at the base of the big toe, there's no reason why people can't wear heels after big toe surgery, after bunion surgery, sorry.